So first and foremost, what we're doing and why I'm here, doing this interview is because we're trying to get the word out. So for a year, we engaged in a public kind of outreach campaign. We got billboards around Riverside County, several billboards along our freeways.
You're listening to the voice of Mike Hestrin, Riverside County District Attorney, who is describing his office's multi-step campaign to combat the rising fentanyl epidemic within his jurisdiction. Since the beginning of 2022, Hestrin's team has begun an advertisement campaign through traditional and social media centered around the dangers of fentanyl. They are also sending prosecutors and fentanyl awareness advocates to school districts throughout the county to educate students about the truth of the drug epidemic. Their last solution to this project, however, differs quite a bit from the other two.
The last thing is that we took a very hard line and we have begun to investigate and prosecute cases where a drug dealer furnished or sold someone fentanyl and they died. We're prosecuting some of those cases for murder.
Mike Hestrin and his office have begun to prosecute suspected fentanyl dealers with murder. To be exact, his office is charging accused dealers with second-degree murder, which is punishable by a term of 15 years to life in California if their sale can be traced back to an overdose resulting in death. According to Hestrin, the Riverside County DA's office has charged 13 suspected drug dealers since they first started the practice in 2021. He also stated that his office works with local police and the sheriff's department to prove the accused drug dealer knew they were selling fentanyl and knew the potential dangers of the drug before indicting murder charges.
I'll give you an example. Say a drug dealer is, again, a lot of these transactions are online or by text, so that's evidence for us. We can go to the companies and pull those text messages, or even messaging apps. We can get all those things in law enforcement. And a lot of times we see the conversation between the drug dealer and the client, and there'll be things in there like, hey, this is fentanyl, it's very deadly, this could kill you, make sure you only take a quarter of a pill, things like that. Or the drug dealer is aware and discussing, for example, that two other people died of an overdose from fentanyl, and yet they're still selling. So those situations, we're taking a hard line. We're basically saying, look, you've got to know as well that folks that deal drugs, you're peddling poison. It's different because it's so lethal, and so when people die, you're going to be responsible for that.
Hestrin also made it very clear that his office is only interested in prosecuting fentanyl dealers for murder, not every drug dealer in Riverside County. He cites the extreme levels of toxicity the synthetic opioid contains in relation to other drugs.
I've had people say to me, well, why just fentanyl? Why not prosecute every drug dealer for murder? And my response is, we can't, because the way that we prove that murder case against the fentanyl dealer is by the toxicity and the lethality of this new drug. It's so lethal that someone takes fentanyl, they might take it for months at a time, but then they get a pill that contains a lethal dose and it's over. So it wasn't that their body built up a tolerance, it's that there's no safe way to use fentanyl. It's too toxic, it's too lethal. And so that's the difference.
Prosecutors further north, like in the San Luis Obispo or Contra Costa counties, have brought similar charges to suspected drug dealers, but Hestrin's office was the first to do so in Southern California. Now, San Bernardino and Orange County seem to be following suit, but health officials within the IE are pushing back on the idea. Instead, some want to promote a multifaceted approach, focusing on destigmatizing addiction and harm reduction services. It's two completely opposite approaches to the problem, which begs the question, what is the best way to mitigate fentanyl deaths within the Inland Empire? From Riverside City College Viewpoints, in partnership with California Humanities through the Democracy and Informed Citizen Emerging Journalist Fellowship Program, I'm Tim Nacy, and this is Fentanyl Empire. This is the final episode of our three-part series. Where does the Empire go from here? Days before District Attorney Hestrin filed a murder charge against a suspected fentanyl dealer, a California Senate bill centered around prosecuting fentanyl dealers was introduced to the Senate desk. California Senator Melissa Melendez, who represents Inland Empire cities that fall under District 28, authored and introduced Senate Bill 350 in 2021. The bill would have required individuals convicted of distributing fentanyl to receive a warning alongside other normal drug-related charges. If the same person were to be caught and convicted of the same crime again, then SB 350 would allow the individual to be charged with voluntary manslaughter or murder. The bill was killed just a little less than a year later, but was reintroduced as SB 1350 at the beginning of this year. Here is California State Senator Melendez on why she reintroduced the bill.
These drug dealers are just getting off scot-free. I mean, it's as though they're selling some, benign drug out there, and they are just not. And parents are finding their children, dead in their bed in the morning when they get a checkup on them or wake them up for school. So, we didn't have a lot of success with SB 350, unfortunately, got killed in the Public Safety Committee. But Matt Capilouto, who is a constituent of mine, his daughter died from a fentanyl poisoning, and he was the genesis behind this bill. And I made a promise to him that I would continue with this bill in the hopes of getting it through. So we have reintroduced SB 1350 this year.
Hestrom believes Melendez's bill is a good start, but that California lawmakers should begin to have a conversation with district attorneys across the state to create a statute similar to the federal government's enhanced penalty when drug trafficking causes serious bodily injury or death.
I do think that we do need help, with the law. For example, if we had a law, on the federal side, they have a law that says if you deal drugs, any drug, and you kill someone, you can be responsible for their death. It's not murder, though. It's something else. It's like dealing resulting in death. And so I would like to see something like that in California where it didn't just have to be murder. So if you had a drug dealer who caused a death, we could charge them with this other crime, and the penalty would be severe, but not necessarily murder. Because, the murders should be reserved for the most severe of those cases, but also, we could have like a crime of causing death by dealing fentanyl that was specific to fentanyl that would help. It would help people to understand how serious this is.
At the beginning of the year, Hestron hosted a press conference about fentanyl. On the stage next to Hestron stood Melendez, Sheriff Chad Bianco, San Bernardino County DA Jason Anderson, and Orange County DA Todd Spitzer. Alongside these political figures stood the families of victims holding posters of loved ones lost to fentanyl. Matt Capilouto, who has felt the same hardship many other parents in the room felt, spoke in favor of SB 1350 and the dangers of this illicit drug. Melendez urged the community to reach out to politicians and voice their support of SB 1350. In our interview with her, she expressed what it would mean to her if the bill were to be put into statute.
Well, it would be great if the state legislature would put this into statute so that every district attorney across the state was on solid grounds and solid footing with this. But we have yet to be able to do that. So I am very proud of the fact that Riverside County is, kind of stepping into the void and doing this, and other counties are following suit. I mean, Orange County certainly is doing so, San Bernardino, and we've seen some other counties across the state doing this as well. But, I think these DAs really need that support of the legislature and it being written into law and into statute.
It will be Melendez's final opportunity to pass this bill, as her term will end December 5th. However, there's still a lot of legislation at the state level that looks to mitigate the fentanyl epidemic. There is a bill that would reclassify fentanyl as a Schedule I drug and make possession for the purpose of sale punishable by up to 6 years in prison. It would also make the sale of fentanyl through social media punishable by up to 9 years in prison. Another would offer a grant to create pilot programs in the counties of San Bernardino, Riverside, and Orange, which would offer free naloxone to individuals who attend a training program. It would also give a grant to said county's law enforcement to create an overdose response team. And then there is yet another bill that would require social media platforms to create policies that prohibit dealers from selling controlled substances on their platforms. This is a policy that Steve Filson is particularly passionate about.
I get it. Snapchat is such a broad platform. They say that they don't have the resources or they can't control everything. Okay, well, I don't believe that. Put it this way, Ann Milgram, the DEA administrator, a couple of months ago during a news conference, pointed out that Snapchat and other online platforms were able to control, child sex trafficking, child pornography, and everything else. They're able to deal with that. Why can't they deal with people distributing narcotics? Kids can go onto the websites, particularly Snapchat. Like I said, our most experience is with Snapchat, and they're able to find somebody that's distributing it. Okay, they order it up, a person delivers it to their home. We've demanded that Snapchat put some, mediation tactics into play there. And if it means hiring more resources that can do that type of thing, that's fine. Then do it.
To a person unfamiliar with the judicial system, all these bills can begin to sound the same. But for the lawmakers, it is an important step in the right direction to help mitigate the crisis. District attorneys and California lawmakers are trying to find an effective but firm way to cut off the availability of fentanyl, despite criticism of their policy's severe punishment. But even someone like Filson, who explained to us that he was supportive of raising fentanyl's classification, also held some reservations when it came to local district attorneys' move to prosecute dealers.
I don't know if it's a resolution, but it's one component of it. Again, education, awareness, enforcement, and then treatment. That's what we have to work on. Is everybody going to be prosecuted for murder? Well, heck no, you can't do that. That's not reasonable. But in those situations where the district attorney has provided information by the police that indicates that a person had intentionally distributed something that they knew could have killed somebody, they have a responsibility to prosecute it. Okay, and again, it's on a case-by-case basis. It's not that situation. My daughter's case is there, and it hasn't been prosecuted. So what's going to happen with it? I don't know. But whatever happens is irrelevant. Education and awareness. Jessica's dead. Nicholas was killed with her, and 2 other people were killed. We want to prevent others from the same fate. That's the bottom line.
Moving forward, Filson's goal is to promote awareness and education. His main concern is ensuring that others don't face the same pain he felt when his daughter died from an overdose. Hestrin, on the other hand, is using his power as district attorney to address this crisis, but also emphasized that he just wants to make sure unsuspecting users aren't falling victim to the drug.
So what I would say is, don't discount what I'm saying because I'm in law enforcement, and you might be thinking, a young person might be thinking, oh, another person in authority telling us not to use drugs. That's not what I'm saying. I would urge you not to use drugs, but that's not what my message is. My message is fentanyl has changed everything, and you have to do your own research. You have to figure out the threats that you're facing because they're real. Fentanyl's everywhere, and there's just no safe way. You can't avoid it. The only way you can avoid it is you cannot experiment with drugs anymore. I know that's a message maybe that not everyone wants to hear, but all I can do is tell the truth and hope the best.
The Inland Empire's law enforcement officials and policymakers are not the only groups working to mitigate the fentanyl epidemic. Many employees within the county's behavioral and public health departments are working hard to create a solution to the crisis, except their plan is vastly different from the IE's elected officials. They want to promote a multifaceted approach, focusing on destigmatizing addiction and harm reduction services. They also acknowledge it would be near impossible to decrease demand and distribution for widely available drugs. Therefore, the goal is to minimize the rate of overdoses while also building trust within its community. This is clearly a different tactic than what was used during the meth epidemic of the 90s and 2000s, and one that Wendy Hetherington, Chief of Epidemiology and Program Evaluation Branch, wants to implement.
So I think, from a public health approach and actually from a society approach, we should, one, destigmatize addiction, because addiction is just a chronic relapsing, disease. Also then, preach harm reduction. So this includes things like, don't use alone, know what you're using, like either with fentanyl test strips, make sure your friends and family have Narcan. There's a don't use alone or never use alone hotline that people could call if they don't have friends or family around them, to make sure that they can use, drugs safely. But I think that's just the biggest take-home message is we need to do more harm reduction.
It is a sentiment that Dr. Michael Levine, Associate Professor of Emergency Medicine at University of California, Los Angeles, also promoted.
So I will say this is my personal opinion. This does not necessarily represent the views of UCLA or the regents of the state of California, or this is my own personal view. That harm reduction strategies are needed. Probably the biggest one is dispensing patients with Narcan. So obviously we tell people not to use drugs, but I think it would be naive to suddenly assume that just because we say that not to use opiates, that you're never going to use. So we certainly encourage patients not to use. We discuss the harms of using, but if they are going to use, they should use with a friend, and they should not use at the same time. So if you and your friend are both going to use opiates, one of you uses first, you have Narcan there. So if you become unconscious, your friend could give you Narcan and then still needs to call 911. But if you're going to use drugs, you should do it not by yourself, because if you become unconscious, there's no one to get you help. And you shouldn't use it at the same time, because if you both use it exactly the same time, you both go unconscious at the same time. It doesn't matter that you have Narcan sitting with you. So probably the biggest thing, more than anything else, is use with a friend and don't use at the same time. Obviously, don't use at all is the biggest way to prevent getting an overdose. But if you are going to use, you should use risk mitigation strategies such as using with a friend, not using at the same time, and then ideally not injecting either, using some alternative route, whether it's smoking or insufflating where you snort it, or using some non-injectable route, which largely minimizes the risk of getting an infectious disease that you would get otherwise from shooting.
Those against the idea of harm reduction campaigns pointed to potential flaws in its strategy. Mike Hestron felt that the model is a policy mistake because the government would, in effect, be financing drug use. He also stated that an argument could be made for harm reduction tactics to mitigate heroin or methamphetamine use, but not fentanyl, due to its lethality. Melendez believes that the model enables addicts to continue using, the programs don't require users to enter treatment programs, and that individuals without sufficient treatment would overdose anyway. However, there seems to be a misconception about what harm reduction is. According to the United States Substance Abuse and Mental Health Services Administration, harm reduction is a strategy that is meant to directly engage with people who use drugs. This direct contact can help prevent overdoses, infectious disease transmission, improve the well-being of those served, and to offer healthcare options. The Centers for Disease Control and Prevention even reported that syringe service programs are proven to reduce HIV and hepatitis C by about 50%. The Centers for Disease Control and Prevention even reported that syringe service programs are proven to reduce HIV and hepatitis C transmission by about 50%. It is a process that Wendy Hetherington explained in depth.
Harm reduction is just behaviors that reduce your risk of acquiring a disease or reducing your risk of having some sort of outcome that you're trying to prevent. At needle exchange programs, you're not just handing out needles and gathering up the dirty needles. You're not just that. It's an opportunity to provide education, to have information for treatment, to have information for more harm reduction practices. And so, you may go to a needle exchange program pretty regularly. And then, one day you may be ready for treatment. And, at these programs, there's information on how to get treatment. So it's there for when you're ready. And I think that's what's most important about harm reduction programs. It's not just, like, here's a clean needle or here's a fentanyl test strip. It's that there's all this other messaging and interaction that we could help people, and as well as not only related to drugs, but usually at these places or when we do it, there's more information on how to get other services, so like medical care or dental care or behavioral health care or something. So it's not just like giving needles out.
Building trust with users is an important component of harm reduction because it allows the harm reduction specialists to have an open conversation about treatment. And that is where Will Harris and his office come into play. Will Harris is the assistant manager for the Substance Abuse Prevention and Treatment Program within the county's Behavioral Health Department, where they offer a new treatment option, as he explains.
Here in Riverside, we've had the advent of a new program that came into being about 2017. It was called the Drug Medi-Cal Organized Delivery System, and it revolutionized the way that we were able to offer treatment services for Medi-Cal beneficiaries. And so it opened up the door to treatment. We were, in the past, all we could really offer at the county clinics were outpatient and intensive outpatient services. But with the DMC ODS waiver, we now have the opportunity to offer residential treatment and have it covered through Medi-Cal. So that was a huge, huge win. And so fortunately, that preceded the major fentanyl crisis. So at least we're armed with the ability to treat many, many more people than we would have been had this happened 10 or 15 years ago.
On top of their residential treatment, the Behavioral Health Department is also working on preventative strategies. Like Void, Harris's team is also going to different schools and giving presentations on the dangers of fentanyl, while at the same time offering programs for the youth.
Our prevention strategy here in Riverside County is one arm of it. There's three separate arms. The first arm we offer is the Friday Night Live program. Friday Night Live is a statewide program. It's a youth development program aimed at providing opportunities for community engagement, opportunities for leadership advocacy, providing a safe environment, providing connectedness to community and connectedness to school. And we have the largest Friday Night Live program here in the state of California. The other way that we approach this is that we offer a program designed for high-risk youth, students that may have gotten suspended from school, may have gotten into a little trouble with the law, but they are not at the level yet where they would qualify for a diagnosis of substance use disorder. So we have a special program for those kids, and it's called the Individual Prevention Services Program, or IPS. And that program originally we offered at our 11 county-operated substance abuse sites. It's a one-on-one intervention with the young people.
For many young adults who didn't have the best childhoods, it was finding something positive to use their talents with that allowed them to overcome their beginnings. Harris is an advocate of this idea as well.
And the program is designed not to look for pathology within the young person, but to look for strengths. And the approach to this is an individual one-on-one meeting where we explore the strengths in the young person's life and try to use those to help turn around the behavior so that they can meet some of their goals that they have in their own life. Not so much that we're telling them you don't want to do drugs, but we're talking to them in a way that are like, well, you said you wanted to graduate high school. How do you think the drug use is, give them some motivational interviewing and help them come up with their own solution.
Also partnering with Harris and Behavioral Health is Rebecca Antillon, who is part of the Opioid Overdose Awareness and Prevention Program. It is a program that specializes in having open conversations about drug use with students and to identify young adults who might be using drugs as a coping mechanism for trauma. Through their intervention, they attempt to steer perspectives about drug use and address the root cause of their growing addictions. They also employ a screener test called CRAFT, a quiz that the Behavioral Health Department recommended. It is similar to the ACE quiz mentioned in our previous episode. If the student falls between a medium or high risk, then they are referred to a school counselor or behavioral health specialist.
So that's why the pipeline that we've established, like with our behavioral health department or with the counseling department on the school campuses, through the screener that we use is really helpful because many of our schools have shared, these are students that we wouldn't have even known about had they not been able to take the screening tool, right? So we know we've been able to at least capture some students that were not on their radar. And so they were able to get connected to support much sooner than they probably would have. We also know that part of our program is expanding too, and we're going to start expanding into the schools to offer more education and training about what does resilience mean, what does it look like to start engaging and building your healthy coping strategies. Because I think that's so important. If we can start talking to our kids and supporting them moving towards addressing past trauma and pain that they may be feeling, encouraging them and empowering them to reach out and offer and connect with support if needed, and then start thinking about what can they do themselves to lean into other strategies that aren't going to harm them, but are going to help them deal with the ongoing pain or distress that they're feeling, I think we're really going to start seeing some decreases.
The Opioid Overdose Awareness and Prevention Program is fairly new, as they launched their pilot program last year. But in their short amount of time, they have already expanded to 9 schools, had 2,108 students enroll in their classes, and have given 595 students a CRAFT screener test. At the end of the day, The IE has come to realize that the fentanyl epidemic has reached its front door. It has reached the point where the community cannot just shine a spotlight on the crisis and warn its residents of fentanyl's impact. From the perspective of both elected officials and the public health department, action needs to be taken quickly, and they are asking the community to rally behind those who are working hard to mitigate fentanyl's effects. The Inland Empire is a region full of proud residents. They are proud of the IE, not because they believe it is perfect, but because it is their home. And now that their home is in danger, it's going to take a united effort of awareness, education, and action to ensure that those who are at the greatest risk don't suffer the same fate as many before them have. Or, as Michael Moya put it, be compassionate, be understanding, and be loving. Again, Moya.
What advice do you want to give to other individuals who are probably listening to this and they might have relapsed or they might have gone a similar route you just went? What advice do you want to give to them?
Don't give up. That's it. Just don't give up, man. I've been in treatment 10 times, if you're not counting detoxes and everything else, probably more. And I think the constant theme of that is just not giving up on myself, Like there's been moments where I'm like homeless in my car, smoking dope, fentanyl or heroin, whatever it is, and I'm like crying, looking in the mirror, literally crying, like I don't want to do this anymore, but why the fuck am I doing it? You know what I mean? And I think a lot of times as an addict, we get really hard on ourselves, that negative self-talk is really prevalent, especially in addicts. It's insane. But yeah, just don't give up, man. Don't listen to that voice in your head that tells you you're a piece of shit, you're this, you're that, you can't do this. Because if you're listening, who's talking? Because you can't do both at the same time. That's not you. That's that negative self-talk, that parasite, that's only there to bring you down.
What do you want people, who aren't addicts or who haven't experienced, not even a cousin or family member that's gone through this, what do you want them to hopefully understand about, what life is like, going through this journey?
Well, I think the fucked up part about that is that I don't think they can understand. I don't think they can. But all I can say is that be a human being, be compassionate, be loving, be understanding. Everybody has their demons, everybody has trauma, and some of us have just learned better ways to deal with that trauma than others. I didn't wake up, or I wasn't born and decided I wanted to be an addict. It's nature and nurture. It's your environment, and it's also some DNA factors involved too. So it's like winning the shitty lottery. You know what I mean? So I guess just be compassionate. Try to be as understanding and educate yourself about it if you can.
I'm Tim Nacy, and this has been Fentanyl Empire, the Inland Empire's latest drug crisis. Thanks for listening. Fentanyl Empire is produced by Daniel Hernandez, Will L.G. Stevens, Jennifer Vasquez, and Tim Nacy. This episode was written by Daniel Hernandez and Will L.G. Stevens. It was narrated by Tim Nacy and edited by Daniel Hernandez and Tim Nacy. If you or anyone you know is suffering from any kind of substance use disorder or mental health crisis, you can find some resources in the description and on our website, viewpointsonline.org.